Hi, my name is Rasmus Rothenberg Larsen, and I am an assistant professor at the University of Toronto, Mississauga. Today's talk is entitled The Hare Psychopathy Checklist Revised, a clinical construct whose time has passed, question mark. Um, Today, I will be talking about, first, I will begin saying a little bit about the psychopathy checklist and its general forensic justifications. And then I will talk about a research that my colleagues and I conducted and published last year, where we looked into the empirical justification of the psychopathy checklist. And in this study, we found some somewhat surprising findings. And I want to propose that these findings might raise some important questions about the future role of the psychopathy checklist. I'm assuming that everybody in this room are fairly familiar with what psychopathy is. Psychopathy is usually understood to be a personality disorder that is associated with this predatory like behavior and psychological dispositions, such as a lack of conscience and empathy and so forth. Here, famously captured by Robert Hare in his modern classic, Without Conscience. Um, but the Hare Psychopathy Checklist Revised is a structured assessment tool that is designed to assess who among a criminal population is psychopathic. So, and it does so by assessing the clinical subject in terms of 20 checklist items that loads onto a two-factor solution where you have personality traits on the left side here on factor one and general antisocial behaviors on factor two. Um, the way it works is that that a clinician can enter a criminal population and design a semi-structured interviews and then assess to what degree a clinical subject meets or matches, if you will, quote unquote, these various items from the PCLR, and then select psychopath within the criminal population. And this diagnostic claim is, of course, seen as surplus or non-trivial information that can inform judicial, correctional, and clinical decisions. Everything ranging from sentencing to placement to treatment amenability decisions and so forth. Now, the PCLR is widely applied in today's practices throughout Europe and North America, at least, and this has been covered in studies. For example, here a study by David DiMatteo and colleagues from 2014 have shown that the PCLR has been exponentially growing in its presence in case law. If you go into the case law records, you will see that the PCLR is taken up a larger and larger role, which started in the 1990s, which of course correlates with the adoption and publication of the PCLR. And this is also similar tendencies is also shown in a study here by Jay Singh and colleagues from 2014, which found that the PCLR is among the most utilized tools by forensic psychiatrists and psychologists to make forensic evaluations about risk, for example. So the PCLR is used in forensic settings to inform various decisions, of course, but there are three fundamental justifications for why practitioners prefer to use the tool. The first justification is generally that the PCLR is believed to predict who among the offender population is the most dangerous, and this is tied to the general belief that psychopaths has social predatory-like behaviors and personalities, and then that the PCLR, in virtue of it being designed to assess psychopathy, can kind of pinpoint who are these individuals in a population, for example, in a prison population. The second justification is that the PCLR is predictive of untreatability and the inability to rehabilitate. In other words, that psychopathy is a chronic condition. There's also been claims in the literature that psychopaths even have adverse treatment outcomes associated with various treatment strategies. So obviously this can have important carry important information in various contexts. Now, the third claim is that psychopath or the PCLR can, in virtue of it assessing who is a psychopath, can therefore also predict who has a lack of conscience, lack of remorse, incapacity to empathize, and generally this wholesale problems with navigating the moral space, if you will, to use a very broad terminology. These three justifications is not meant to be or to be controversial. They're very much already a central part of the mainstream research literature. Starts with Hare's seminal paper from 1996, and then has made its way into the second edition of the PCLR manuals, thoroughly discussed these three justification, and of course we find it also discussed very elaborately in some of the most popular anthologies. Now, in this study that we conducted and published last year in Psychology, Public Policy, and Law, what we did was that we asked three basic questions, namely, whether it really is the case that we can say that the PCLR is empirically linked to predicting dangerousness, untreatability, and a lack of conscience. Now, what we did was that we conducted a PRISMA review, which eventually and we navigated all the research that has targeted these different questions, and eventually we ended up with hundreds of research records, which of course included thousands samples of thousands of diagnosed psychopaths. And I want to go over what we found, what was the key findings that we found in this research literature. Now, to the first claim about dangerousness, we found that the PCLR can statistically predict criminal recidivism, for example, and violent recidivism. But we found that this predictability it was not linked to strong effect sizes, but only with weak and moderate effect sizes. And we also found a range of important caveats. So, for example, the PCLR appears to perform significantly worse than other ordinary mainstream risk assessment tools. And in fact, one of the main reasons why some clinicians perhaps prefer to use a PCLR is that it has this component of personality traits that, at least that was the original justification for using the PCLR in risk assessment context, was that it can assess whether a person has these callous personality traits, which was assumed to have predictive capacity, such as predicting violence, for example. But we found that it's actually not the case, that these factor one items, so to speak, personality traits are not what makes the PCLR good at predicting, for example, recidivism. In fact, it's the very thing that seems to detract from its predictive capacities. So if we didn't use it, the PCLR would seem to perform on equal levels as other risk assessment tools. Now, in terms of the second claim about untreatability, we found that there was absolutely no evidence in the research literature that psychopaths are unresponsive to just like ordinary treatment and rehabilitation strategies. In fact, we found that there were positive outcomes across targets and across methods. We also found no evidence of the PCLR or psychopathy being associated with adverse treatment effects. Instead, what we found in the research literature was that this view was widely dismissed by contemporary researchers. In fact, the only study that has historically been linked as or used as evidence for the view that psychopaths are linked to adverse treatments outcomes is from one study by Marnie Rice and colleagues from 1992, which was based on an infamous treatment, quote unquote, program from a Canadian penitentiary where recently, as only 3 to 4 years ago, it was ruled in an Ontario Supreme Court that this program, this alleged treatment program, was actually nothing short of torture. That the people ran the program was just deliberately maltreating their patients. Now, in terms of the third claim that PCLR can predict a lack of conscience and in a wholesale incapacity with the moral domain, we found that there was just no robust evidence of this claim. That, in fact, one of the more surprising findings was that while it is commonly claimed that psychopaths are without conscience and have no remorse, we actually found that there's not a single empirical study on this substantiating this claim. We know this. We found this surprising because there are volumes out there that seems to have this claim embedded in their title. We also found that there was perhaps some tentative evidence that there are differences in empathic responses. But again, we didn't find that there was an incapacity to empathize, just that there perhaps could be subtle differences. These studies are often based on small sample sizes, so it can be hard to really ascertain. Generally, we also found across studies that when it comes to making moral judgments, PCLR psychopath appears to perform just as well, or at least on the same levels as other fellow inmates or other offenders. These results I want to propose here toward the end, that I think that these results that we found in this study seems to at least raise some important issues and questions for future researchers to contemplate, and also for practitioners to think hard about. First, I want to say that if it really is the case that the forensic utility of the PCLR is overestimated, then we have to ask ourselves, I believe, whether our institutions should keep spending resources on conducting these assessments. Psychopathy assessments takes a lot of resources. It takes hours of interviews and reviewing of patient records. But is it really worth it if we cannot yield, if the test itself doesn't yield the information that we usually thought it would? Second, I want to say that what about those individuals who have been subject to having a PCLR assessment restrict their legal process in one way or the other? What do we do with these individuals? For example, a person who was, because he or she scored high on a PCLR assessment, wasn't enrolled into a rehabilitation program, which later was seen as a negative piece of information in his or her parole application. What do we do in a situation like that? Third, I also want to say that psychologists and psychiatrists are committed through their ethical code to conducting or to practice in a way that is aligned with the empirical research. In other words, our practices should be substantiated by empirical science. But here we have a situation where the PCLR appears to not have that empirical backbone anymore that was initially thought. Does that mean that we can no longer ethically defend using that tool? And lastly, I want to say that perhaps some of these results are really foreshadowing a much more basic or fundamental truth, namely that perhaps the construct of psychopathy is not a real construct. It's not a real disorder. This was actually a view that was widely held in the 60s and 70s, and it's only in the 90s and onwards that psychopathy has been broadly accepted as a validated disorder. Maybe these results are really just showing that this could fundamentally have some problems. Okay, that was all for me today, and I hope you enjoyed the talk, and I will be looking forward to continue the conversations afterwards. Thank you very much.